Okay, I guess we're recording.
Yeah.
Hello. Welcome to Healing Heart Connection's first ever connection video. I'm
Wow.
here. Yeah, I just made that up right now.
Yeah.
Um, I am here with a good friend of mine who I respect very, very deeply. He's part of my doctoral cohort in the clinical psychology and social or school psychology program. And I'm going to let you introduce yourself, actually. So go ahead.
Sure. My name is Jordan Hoppus, and I'm, as you said, in your doctoral cohort at Roberts. And so I guess I don't know. The thing I always lead with is I'm a very psychoanalytically oriented practitioner. I call myself psychodynamic because you're not allowed to call yourself psychoanalytic until you go to an institute. But if we're honest, I think about things mostly analytically. Um,
You're a
bef-
future analyst.
I'm a future analyst. I'm a wannabe analyst. I guess fake it till you make it analyst. But it's yeah, whatever that means. So before I started this, I was a high school chemistry teacher for all of 1 year. Um, I guess I was a student teacher for all of 1 year, and then before that, I was a biology graduate student. So I've done a lot of things.
It was entomology, right?
It was entomology, yeah, which is like the study of insects. Specifically, I studied aquatic insects. So insects that would live in streams and can serve as biomarkers for like water quality. So
Mm.
like if water's really clean, certain bugs can live there, and if it's dirty, certain bugs can't live there. So you go out and you collect bugs out in a stream and you catalog which ones are living there, and you can give the water a quality index.
Well, can we do another interview on that? Because that sounds
It's
fascinating.
actually super fascinating. And in regions where you can't have like detection mechanisms to like determine the cleanliness of the water, you can actually use those techniques to determine whether the water is safe to drink or not.
I believe that when I was a little side quest here, when I was apprenticing on an organic permaculture farm,
Mhm.
and learning about how to like actually make gray water. Um,
Yeah.
the one of the tells was if birds will land and drink in the water, then it's safe to water the crops with it.
Yeah.
So
Yeah. Yeah. That makes sense.
um but back to psychology. Maybe give the like ELI 5 explanation of what you're saying or what you mean when you say that you come from a psychoanalytic perspective.
Yeah. Basically, the idea is 150 years ago or so, the guy Sigmund Freud, who has a pretty bad rap nowadays, um, he was a neurologist. He ended up studying with a dude named Joseph Breuer, who was trying to figure out the origin of what they called back then hysterias, which were neurological conditions or illnesses, like paralyses of limbs or like blindness or deafness that couldn't be readily explained physiologically. So basically, your legs were paralyzed, but there was nothing about your body that would indicate your legs should be paralyzed. So eventually, neurologists started to become convinced that it must be something emotional or something psychic, something psychological that was at the root of that. So Freud went and studied hypnotism for a little while. Hypnotism wasn't really working on hysterias. So then he ended up joining Joseph Breuer, and Joseph Breuer was doing this sort of like talk therapy, right? Where they would just talk things out, and they were hypothesizing that maybe if you took the stress that created the hysteria and you talked it out and resolved it to such an extent that it felt resolved to the person, then maybe it would be the resolution to the condition.
Mhm.
Which, to be fair, I mean, I say nowadays that's a very great hypothesis. I mean, we still deal with hysterias nowadays, except we call them conversion disorders. which, exists in the DSM-5. You'll have people that will feel like they have paralyzed arms and things like that. And now we have tests, like, for example, if you go to a psychiatrist and you say your arm is paralyzed and he doesn't believe it, really you'd go to a neurologist first. They'll lift your arm above your head and then they'll drop it. And if you hit yourself in the face, then it actually is paralyzed. But a good test for conversion disorder is you'll drop it and it'll slide like away from their face almost supernaturally. And it's because their brain still has connection
Still connected, right?
with their arm.
Right.
Right.
So yeah, so psychoanalytic meaning in sort of in the tradition of Sigmund.
That guy. That guy. Yeah. Later on, he would separate from Joseph Breuer, and he would start to figure out that these symptoms that were hysterias or anxieties or depressions or things like that were created, he thought, by memories or traumatic experiences that you have buried really deep down in what he would call your subconscious. Right. And when you bury these deep down, they get compressed and they have to come out somehow, because that's our natural effort to sort of, the term they use is abreact, but to sort of push these out, except since you can't recognize them and push them out whole, they come out in little pieces as symptoms. Right. So they might come out as paralysis or anxiety or something like that. And his hypothesis was, so if we get to these, rather than doing Breuer's just talking cure, if we can get to these things that are pushed down and hidden away, then we can be on the fast track and your symptoms will go away because the thing will be resolved.
Get to the root of it.
Yeah. Get to where it came from.
Mm-hmm.
And his entire career was coming up with techniques and discovering patterns of types of what he called neuroses, which were these things being buried, resulting in symptoms. So
yeah.
I don't know if that was the ELI-5 version of it, but that was my version of it.
It was beautiful.
Thanks.
Thank you. Yeah, I guess I have a follow-up question for that before we transition to like the formal subject matter of anxiety.
Mm-hmm.
So I don't actually know who's going to be watching this, maybe no one,
Yeah,
but
sure.
but my hope is that a majority of the audience is actually not going to be psychologists and therapists, but more like mental health consumers, like folks who are in therapy themselves and that sort of thing. So something I've heard from a lot of my clients is, oh yeah, Freud, wasn't he the guy who was super addicted to coke and was like really sexist and like created like penis envy, and like, why are you talking about that guy? Like, I've heard that a couple of times. So
yeah.
when you I imagine you've gotten that as well. Like, what do you say?
Yeah.
What do you say to your clients even when they ask you something like that?
Yeah, so it matters a lot, like the sociological understanding of Freud. So, was Freud addicted to coke? Yes and no. There was a period in his life.
He can stop whenever he wants. No,
yeah, he actually did stop whenever he wanted. Yeah, back then cocaine was used as a pretty standard analgesic, and no one really. This is my understanding of history. So a historian could come in and say you're absolutely wrong. But from my understanding, no one really had a firm appreciation for how addictive it could be, And so during Freud's 20s and 30s, I think it went up into his 30s, he used cocaine recreationally, yes. And then he just stopped. So there's no evidence that he had a lifelong addiction to cocaine. But yeah, I mean, yeah, he did do cocaine for a while. But that was fairly normal. So for him, for the sexism, so I think where the sexism comes from is we have these terms like penis envy. And later on, a woman named Karen Horney would come in and sort of really thoroughly critique Freud's understanding of penis envy. But I think if you take a modern read on Freud's understanding of penis envy, what he was trying to communicate was that women in the Victorian era had a natural envy or desire for the power and place in society that men had. And Freud characterized this difference. I guess he symbolized it in the symbol of a penis. And so when he would talk about dreams and other experiences, like women having dreams about riding horses across the plains and things like that, um, he would characterize those as dreams which were indicative of a penis envy, right? That they wanted to have a penis. But if you take that further, I don't think it's a critique on female anatomy or femininity, right? I think it's a critique on a patriarchal society. It's essentially saying women had this place in society where they couldn't do whatever they want. They couldn't be whoever they want. They didn't have the same standing and place in society that men had. So if they only had a penis, then society would free them from these imposed bonds. And I think from a modern feminist take, looking at the Victorian era, I don't think he was far off. I think what he was making wasn't a critique of femininity, but rather a critique of patriarchal, oppressive society. Was it phrased in an unfortunate way? Yeah, probably. That's the thing. And Karen Horney would later come in and make a similar argument. She would say women don't envy men's penises. Women naturally see the injustice in the fact that they're not allowed to occupy the same spaces in society that men are allowed to occupy. And I really don't even think that that's a critique of Freud's position, but rather I think it's a necessary elaboration on his position. Because Freud had a lot of socially forward positions. His idea of an Oedipus complex of people desiring to have sex with an opposite sex parent started with the seduction theory, which was the idea that a lot of the neuroses and a lot of the hysterias that women experienced in that era were caused by having been molested or otherwise sexually violated by a male family member.
Mm-hmm.
To which French neurologists reacted with scorn and mocking. They said, "There's no way. Nobody molests their children."
Which we know now is
patently an absurd position. That's the thing. And so, but Freud was so invested in the idea of popularizing this new form of psychiatry that he had invented that he was willing to sort of kowtow to them and say, okay, well, maybe they just had a fantasy and it disturbed them. But I think Freud as a character isn't really to blame for some of his more unfortunate opinions. I think he was a really brilliant man in a really flawed time.
Yeah, I would agree with that. Yeah, thank you for that so well. Yeah. So anxiety. So that was kind of what I was hoping to talk to you about primarily today. I know, obviously anxiety disorders is like a large and vast thing, and there's no way we could cover that in one conversation. And of course, also anxiety is a symptom or associated with many, many different types of mental disorders, if you will. But I'm thinking even just for today, more in the generalized anxiety, social anxiety, panic attack realm. And so I guess my first question for you is, coming from that psychoanalytic orientation that you have, what is anxiety, right? Like, what is anxiety? Where does it come from?
Yeah, well, so there's a lot of different perspectives about it. I mean, if you'd ask Freud, he would say it's a symptom. He would say it's a symptom that comes from something buried deep down. And we've moved past that a little bit as analysis has sort of evolved as a field. And so I guess I would say in in big bold letters, it depends, right? Which isn't very satisfying. But I think if you want to understand any symptomatology or any psychopathology, um, Freud gave a really great piece of advice when he said, encounter every new client as if they were the first client you've ever seen. And I challenge that a bit, because you should have some patterns in your mind of things you've seen before, of, techniques you have, but really you shouldn't be, I want to use the word projecting, but I don't want to use it. That's a thing worth thinking about, I suppose. But, you don't want to put your understanding of previous clients or your understanding of yourself on a new client, So when a client comes in, for example, I've had clients in the past that have had really strong anxieties about things. Like the anxiety that comes to mind are clients who will have anxiety about, they'll walk up the stairs and they'll get out of breath and their heart will start beating fast, and they'll start to think, what if I'm going to pass out? What if when I pass out, I stop breathing? What if no one finds me? And then what if something horrible happens to me? So I've noticed two genres. I've noticed clients who will say, what if I die? And clients who will say, what if I pass out and then I'm embarrassed? And then everyone's ashamed of me.
Right.
Right. Everyone makes fun of me because why, you can't even walk up some stairs without passing out. Like what, and people abuse them. So I think if you put those into genres, one of them is the death genre is, when I pass out, I won't have the strength to fight against a world that wants to kill me. And so that's a thing we do in analytical or dynamic psychology. We try to boil things down into the dynamic that's occurring. What's the equation we can boil this scenario down into? And it's not oversimplifying, it's not over minimizing, it's really getting the full extent of the experience and putting it in almost a mathematical understanding of the situation. So one is, if I pass out, then I won't have the power to fight against a world that wants to kill me. Right. Which, even below that, there's the understanding of, the world is not sufficient to satisfy my needs.
Mm-hmm.
Right. I have the need to live. And without me actively taming it, the world will not be there to provide it for me. So anyways, that was a long rabbit trail for that. But the second genre, which is the mocking genre, which is, if you pass out, I'm going to make fun of you, or I'm going to mock you, or you're otherwise going to be defective. That's different. That's you projecting a voice that's inside of you on someone else and assuming that they'll react to you in the same way that someone from your past has.
Yeah.
And an understanding of those two, I guess, formulas for the same experience, understand where you have to dig to, to uncover the thing that they're repressing, so
Mm-hmm.
that you can let it out. Right. So
When you mean you dig to, do you mean you dig to find out which of the two camps it falls into? Or do you mean once you figure out which camp it is, you then dig from there?
Yeah. Once you figure out which camp it is, which, I mean, you're not just figuring out by yourself. Obviously, you're reflecting and you're talking to the client. You're saying, does this fit? So, I mean, if a client were to say that to me, that scenario to me, and we were to go down the rabbit trail of discovering what that's about, I would expect for them to, in their own voice, to endorse one of those two or something else that I haven't thought of.
Yeah.
Right. And then once that's endorsed by the client, and once we talk about that in depth, then I want to find out what's at the bottom of that. Right. And that's when we can go deeper,
Yeah.
and figure out what's at the bottom of that. So why is the world not satisfying to you? You know, why is it not able to satisfy you? You know, and so different types of analysts would disagree on where you go from there. You know, do you go to, was there some traumatic event where you really needed someone and they weren't there for you? And that's what we're going to uncover. Or is there a pattern of what we would call an oral phase rejection, right? Which an oral phase rejection basically just means when you were a baby and you needed your mother to feed you, she wasn't there consistently, or she wasn't available. And that could be literal or a metaphor. As you may be discovering listening to this, this is like weirdly metaphorical and sometimes hard to pin down. And it kind of requires you to think a different way, which is why people who want to be analysts have to see their own analyst to figure out how to become an analyst, because it really takes a lot of time to learn how to think this way.
Mhm.
So basically, are you someone who's been traumatized, right? In that you thought the world was going to be there for you and the world has proven you wrong? Or are you someone who's an adult, but really your personhood is a scared infant who's just hungry and who doesn't have a mother?
Mhm. Yeah, so kind of what I'm thinking about, because I'm not nearly as well versed in psychoanalysis as you are, and that's not primarily what I work from, at least at this stage. What when you're talking about, the different camps of anxiety, I'm thinking of, all the clients I've talked to, and when I wouldn't say never, it's pretty rare that I've had a client say to me, like, if I, walk up the stairs and I pass out, like that's the fear of like death per se, but I've definitely talked to a lot of people with anxiety who have this pervasive sense that like the world is dangerous and unsafe and out to get them. And that like unless they're vigilant all the time and working all the time to like keep the scary stuff at bay, it's gonna get them.
Yeah.
And I've also definitely heard a lot of people talk about just this like pervasive uncertainty, and actually that I would say has been heightened during COVID,
Mm-hmm.
especially the beginning of COVID, right? Like
Sure.
March, April, May. A lot of folks were talking about just anxiety and this sense that like nothing was certain, nothing was predictable, nothing could be depended on.
The whole
Um,
world's been taken away.
Right. And then,
Yeah.
and then from like an attachment perspective, we'll say, because I work from like an attachment lens, I think about anxious attachment. And
Mm-hmm.
anxious attachment happens when the caregiver in early, birth to like age 3 or 7, the caregiver sometimes meets your needs and sometimes doesn't.
Yeah.
Right.
Yep.
And so sometimes the needs are met and sometimes they're not. And so the needs are met often enough that like the young child will still like, there's a chance that my needs might be met, but I don't know if now's the time or not. So I have to like learn to like memorize all the micro movements of like the muscles on your face to know if like my need is going to be met or not. And I
Right.
can tell by the sound of dad's walk if he's drunk coming up the driveway or not, and those types of things.
Mm-hmm.
And then so that's is that, would you say camp number one, like those types of things for camp number one? Oh no, you just went mute. Oh, you're back.
Oh, that's bizarre.
You're back.
Oh, hello.
Hi.
Am I?
Yeah. Okay.
Good. Okay.
So I asked if basically I said all those things and I was like, is that similar to what you're saying about like camp number one?
Yes, and I can explain in more depth of who that comes from. So there's a guy named Winnicott, and I don't know why I'm spacing his first name right now, but it doesn't really matter because how many people are named Winnicott? So his name is maybe a lot of people in Ireland or Scotland. I don't know, but so his name was Winnicott. He was a psychoanalyst, very very famous. He was actually an object relations psychoanalyst, which is totally it's it's a different camp than pure Freudian psychoanalysts, but they have a lot to contribute. Nowadays, sort of a lot, I would consider myself to be more of a modern Freudian, and we integrate things from lots of different areas into this. So Winnicott sort of established this first genre. His argument for what makes a good enough mother, or what makes a good mother, is so the baby might cry because the baby's hungry. And so the mother immediately presents herself, and feeds the baby, right? But eventually the mother starts to notice, every day around 2 p.m., the baby starts to cry because the baby's hungry. So I don't like it when the baby cries. So instead, I'm just going to feed the baby before 2 p.m., right? But the baby gets a different sense. The baby starts to learn, mommy just gives me what I need before I even ask for it. I just get what I need from the world.
The
Right?
world is safe.
The world is safe. When I need something, someone's going to give it to me.
Mm-hmm.
And usually before I'm desperate enough to cry out for it.
Right.
And so that pattern starts to develop into trust, into that basic, Ericksonian trust versus mistrust type of thing. You can trust the world. Now, if that doesn't develop for whatever reason, it could be actually because of your mother, or it could be metaphorically. It could be COVID. At one point, the world is a breast that feeds you before you need it, but now the world is a breast that's basically run dry. You know what I'm saying? Like, you have nothing, and so the idea with this first genre is that at some point you've learned that the world can't be trusted to provide for what you need.
Mm-hmm.
And so with that, our understanding of the treatment becomes a little different. It's not so much about digging up these repressed memories, but instead it becomes much more of like Winnicott's vision of treatment, of being there, requiring nothing from the client, and recognizing the client's needs and providing for the client before the client has to ask.
Right.
Which just means a warm, interpersonal, caring relationship.
Right.
And over time, the client internalizes you and you become mommy number two.
Well, it will become that voice, right? And we'll get to that maybe when we talk more about the shame of things.
Yeah.
But
Sure.
yeah, you absolutely become that voice. And it's interesting. I actually I've had two clients today that both told me that, I mean, I'm a woman, so I think that helps with that sort of transference or association, but both, like, of their own accord, spontaneously realized and then told me that they were that they were reacting to me in a similar way that they had reacted to their mothers in childhood, which was a deep, deep desire to please me. They wanted to please me and they wanted to make me happy, and they were terrified that I would be disappointed in them. And so, yeah, is that sort of along the lines of what you're talking about?
That's exactly it. And how you respond to, what would it be like if I were disappointed in you?
Right.
And exploring what they expect. And in that way, cognitive behavioral therapy doesn't get it all wrong. They go for things like they go for things like, what are your ingrained, core beliefs? And one of your core beliefs can be, when people are disappointed in me, they'll hurt me. Or when people are disappointed in me, they'll mock me, or something else like that. And that's that ultimately gets to the same root as this. It's just, what do we do with it? Do we pathologize it and say that it's incorrect, and essentially move to encourage you to train yourself out of it cognitively? Or do we accept it for what it is, accept you for what you are, and just be kind to you And eventually, by interacting with us, you learn on your own that that might not be so true.
And learning in a deep, full body sense as
Yeah.
well, right? Like
Yeah.
that's the, in terms of cognitive behavioral therapy, didn't get it all wrong there. That's one thing that I don't like about that sort of, that we can think our way out of everything.
Mhm.
It's a sort of top down, because that's not how we learned this to begin with. We didn't learn this. A lot of this stuff was learned pre-verbal, and certainly pre um, uh, very, very, very complex cut, like
Well, we felt our way into it. We felt
exactly,
it and we learned the
exactly.
feelings. That's
Limbic system level, right?
yeah, exactly. And so
Hmm.
if you feel your way into something, it would seem reasonable that you might have to feel your way out of it.
Right, right. And that in the attachment world, we'd call that a corrective experience, right?
Mm-hmm.
You have to experience it in a different way. Um, so something I've heard a lot, and I'd like to hear your thoughts on this, around um, this was, not wanting to disappoint your therapist, or wanting to please your therapist, or that sort of thing. Um, so for example, I use Reddit, and if you I don't know if you use Reddit or if you've gone to like our therapy or
Yeah.
thing,
Mm-hmm.
I would say, like, I've been watching that subreddit for like 5 years, and I think the most common question is some version of, um, should I tell my therapist XYZ? Um, I'm afraid to tell my therapist this. Um, how should I do it? And what would be your response to that type of question?
I would be curious why. Well, I would be curious why that's a concern. What is it, something that's shameful, or is it something that um, you think will hurt me, or is it something that you think if you tell me I'll hurt you? Um, what's that about? And then I'm curious, what do you expect to happen when you tell me? Because everything ultimately is a tool to get to the root of what the problem is. If you're afraid to tell me that, you masturbate 8 times a day, you know, which it's just the first thing that came to mind because it's mildly shameful, I would suppose. I don't know, but that's the thing. It's if you're afraid to tell me you masturbate 8 times a day, I'm not going to be curious. I'm not necessarily here to comfort and to soothe and things like that. I'm here to wonder, what do you expect me to do when you tell me that? Right? Do you expect me to make fun of you? Do you expect me to be ashamed of you? You know, and that reaction, when you get it out of me, who does that remind you of? Is there anyone else who treats you that way? Right? Do you treat yourself that way? Who do I sound like when I talk to you that way? You know, and that's sort of what we're out here to discover. So for example, just going with the same metaphor, not metaphor, same example. If you tell me that you masturbate too much and it gets in the way of your life, like you're avoiding social situations, things like that, like it meets criterion for something you're addicted to, um, then we talked about how you expect me to react to you when you told me that, and they say, well, I expect you to say you're disgusting, you're shameful, or you're like a criminal. Like how you're like going out and in social, you're avoiding social situations. What are you, some kind of freak? You know, I laugh because it's so exaggerated, but that's what happens. That's what a lot of people are hearing in their head, you
Mhm.
know. But I would never say that.
Right.
The version of me that lives inside of your head might say that, but who who's the prototype for me in your head? Is it your mother? Right? Is it your mother wearing my skin? Is it your father? Is it someone you knew as a child? Ultimately, you don't have that data from me.
Right.
You didn't get that data from me of calling you a freak, because I've never done that. So who is it that's wearing my skin that's calling you a freak?
Right. Right.
And that's where it starts. And it goes beyond that. And then once you realize that, you know, different expectations from different people, and you start to come to the conclusion, maybe my mother wasn't the sweetest woman in the world. Maybe she was kind of a bulldozer and kind of abusive, you know, then you come to the insight and you get this emotional granularity. I feel bad around my mother, not because I'm bad, but because my mother doesn't treat me very well. Some people call that emotional granularity. In psychoanalysis, we call that insight. You know, so it's a little bit of a simpler term. So
yeah.
yeah.
And so once this insight is achieved, does the anxiety go away? Like what
No,
happens then?
no, not always. I mean, it will go away to some degree. It depends on so once you get the insight is an intervention in and of itself. An intervention, for people who aren't psychologists, an intervention is basically like, you know, doctor finds out you have a sinus infection, they give you an antibiotic. That's the intervention. You know what I'm saying? So with CBT, the intervention might be mindfulness or cognitive training or whatever. I don't know. I don't do CBT, so I can't even pretend. But like, if somebody, what's the intervention? Insight is the intervention often, but there are other interventions that can be added on, like sort of adjunct interventions. So like, if you start to discover that maybe it was my mom that gave me this anxiety because she was so cruel to me, so rude to me all the time, it helps to understand why she was the way that she was.
Yeah.
Because instead of just holding on to the anger, now we can be forgiving. Now we can be understanding, and we can have compassion. And compassion feels good. It feels good to forgive somebody. Right. Ultimately, in the end of things, I'm not setting a moral standard that you have to forgive your mother if she wasn't very nice to you. But I can assure you it will feel good if you do.
Yeah, well, and I think I want to chime in here because I think the order of that is really important.
Mm-hmm.
Because in the path of healing, and I do this a lot. Like I will talk about with my clients, I'll use the phrase like intergenerational trauma,
Mm-hmm.
right? To explore that same concept. Like, okay, my mom did this to me, but what did her mom do to her, and what did her mom do to her, and kind
Mm-hmm.
of again getting that and my grandmother was a Polish immigrant too, and what was going on in the Polish ghetto at that time, and
Yeah.
what had been going on in Russian occupied Poland before that, and all of this, so all of that, I think understanding and forgiveness are a very, I would say those are often essential pieces in the healing process, but they're not the first piece. Like
Right.
I've had people come to me and say, how do I want to forgive? I want to forgive. And it's almost this like bypassing, like I want to skip over all of the pain and uncomfort and I don't want to feel any of that stuff. I just want to jump right to forgiving and letting go. Right. And on the other side of that, I've had so I would say those people are don't want to see themselves as like a victim or feel the pain of being victimized. On the other side of that, I've seen people who get stuck in the victim stage as well,
Sure.
and feel like affirming their own victimhood over and over and over is what therapy and healing is. And so I just want to chime in. I think that both of those are important, but they have to happen in that order. Like you can't mix the order around.
You have to start with recognition of your own feelings so that you can feel the anger. Because if you don't feel the anger and you don't feel the hurt and the betrayal, then forgiveness is little more than just a defense mechanism. It's just a complex form of avoidance.
Right.
That's the thing. And in the end of things, it's actually, it's a reaction formation. You're thinking I should be forgiving, and so in order to somehow correct the wrongs of the past, and you can't, you just can't do that. You can't you can't you can't really forgive until you feel the gamut of emotions that the wrong created in you. That's part of the process of forgiveness. you know I think a second um, intervention you can add on to insight, and I do this in my own therapy because it's really important to me, is self-regard and just kindness for the self. The phrase I live off of is no one can ever have too much kindness, and people really resist that. Folks really resist
Well,
that.
that's true for everyone except me, Jordan.
Yeah, it's true for everyone except, yeah, exactly. So yeah, people really resist that because they think, well, what if I do the wrong thing? What if I do something horrible? I still don't agree that you deserve abuse. you
Right,
know you still deserve kindness and regard.
right.
That's the thing. It's that same thing that Albert Ellis used to say, that it's impossible to be a bad person. It's possible to be a person who does bad things or who behaves badly, but it's impossible to be a bad person.
Mhm. And I think that the absence of self-compassion, that absence of kindness for the self creates uh, we were talking about the world outside being dangerous and scary. Like that creates an internal world that's dangerous and scary.
It sure does.
And that is pretty anxiety provoking, I think, to live
Yeah.
inside a mind that is so harsh and critical and lacking like kindness.
That's what I've really lately see, because I'm just a therapist in training, obviously. So like I learn things along.
Psychologist in training.
Yeah. what you know I learned things along the way, and what I've been picking up about folks that I've been treating with borderline personality disorder is I've um, I've been learning that um, not only do they split people outside, they split inside, right?
And by
They
splitting, you mean just the ELI
Yeah,
tags?
yeah, fair enough. So when, for example, with borderline, if you know someone with borderline, you might, you know, pay to have their car repaired, and then you'll be put into a category of this person's all good. They're wonderful. They're an angel. They can do no wrong. And then you forget about their birthday, and then all of a sudden you're split into the category of they're completely evil, completely awful. They have never done anything right in their entire lives, and they're incorrigible. Right. So that's the thing. So um, that's splitting, right? But and that's sort of with BPD, people do that externally, but I've started to realize they really do that internally as well. They really feel stuck and paralyzed in their behavior sometimes because they start to think, if I do the wrong thing, then I'm no good. Or if I do the right thing, then I'm the greatest in the world. And they have this push and pull. Like when someone does something wrong to them, they'll think, well, I would never do that because I'm good. Right.
Right.
But then, yeah. And moderating that, part of moderating that is teaching someone, I think we would call that perfectionism in modern speak. But I think part of moderating perfectionism is to teach someone to accept that, you know, if you accidentally ate the whole pizza, you don't have to beat yourself up about it.
Hmm.
You know, you might be curious, why did I accidentally eat the whole pizza? Did I not eat enough today? Am I stressed? Is there something going on? But you don't have to abuse yourself over it,
Hmm.
you know. Um, and it also doesn't make you a bad person to abuse yourself over it. There's
Right.
some reason you do that too.
Right. Exactly. Yeah, we're very complicated. We're very
Yeah,
sophisticated humans. We can hate ourselves for hating ourselves if we want to.
Exactly. All the time, I have a metaphor that I like to use in therapy, and I don't know if this is an ACT metaphor or not. I don't even know where I got it, but it's like, I mean, if you think about, I usually present it while I talk about meditation, because I talk about people's thoughts passing by and things like that, and thoughts are sort of like a stream. They pass by over time, and then occasionally there'll be like a crunchy dead leaf on top of the pond, and you know, people with OCD will recognize those crunchy dead leaves as like, I'm holding a knife. What if I stab my roommate? What are those like crunchy leaves on top of the stream? You know, um, and it's really up to you which leaves you pick out of the stream. It's just a crunchy leaf. It's just there. I mean, why not let it flow by?
Right.
That's the thing. And oftentimes, once I present that, I'll have people who will abuse themselves over the fact that they pick up the leaves, which
Oh,
is the
absolutely.
which is the exact opposite of what I'm trying to communicate.
Yeah, shame for feeling shame,
And
or
things like that.
oh yeah, one of my
Yeah.
favorites is I hate myself for being depressed. That's
Yeah. Excellent. That could not at all be the source. Yeah. No.
um no, go ahead,
Yeah.
go ahead.
No, I didn't really have much to say after that. I thought I did, but you go.
Yeah, I mean, I think I am trying to be conscious of time too. We've got a few minutes, and I wanted to kind of loop back to, and I think we were kind of already getting there because maybe half an hour ago, we sort of created this, camp one, camp two, the top of the
Mhm.
stairs, with the death and the shame, and it sounds like we were also getting to talk about
Shame.
the shame piece around
Hmm.
anxiety, and that's something I
Sure.
see all the time too, right? That this sort of like pervasive worry, anxiety, that people are going to find out that I'm not enough, or they're going to find out that I'm too much,
Hmm.
or they're going to find out that I'm bad somehow. So is there anything else you'd like to say about um, that type of anxiety, or specifically maybe, if someone listening has that type of anxiety, like how can they address it?
Yeah. That's that classic agoraphobia, right? That classic, I'll go out, have a panic attack, and have no way of escaping. There's an entire DSM diagnosis for that. That centered around that, but that feeling exists in a lot of other diagnoses,
Mhm.
right? And in a lot of other conditions that are undiagnosable, uh, at least under the DSM. But like, you know, I think ultimately I have to circle back to what I said a moment ago. You don't have that data from anybody else. CBT practitioners would say, consider the evidence. I'm saying you don't have that data from anyone else. So where's the data from? Who'd you get it from? And so is it your mother? As I said, I mean, we focus on mothers a lot because that's where you learn most of the important stuff from in your life very early on. You know,
With
is it
more
an
stay-at-home dads, we'll be blaming fathers much more in a couple of decades.
exactly,
Don't worry.
or grandmas? I blame.
Mhm.
Ernst Longer is one of the most classic cases that Freud worked with, the rat man, and his father was the root of the problem. His father never paid attention to him except for when he spanked him, and then it became this like angry, like sexual obsession he had with his father. That's the thing. So it's not unheard of for fathers to be the root of the thing too. But um, basically, who taught you that you deserve for people to be mean to you? You know, it's, where'd the cruelty come from? And do you treat other people that way?
And
And
uh, say someone figures it out. Say someone like has the realization that, I learned to do this because my dad was so critical, or I learned to do this because my mom modeled being self-critical, or whatever.
Mhm.
What then?
Find some people who don't treat you that way. That's the thing. Stop treating yourself that way. And if you notice it, there's no reason to judge it. Just, that's my mom's voice.
Yeah.
You can even laugh about it. That's the thing. It's I had a client who would have intrusive thoughts about killing herself all the time with OCD, and she's recently stopped thinking about killing herself, which has been great. You know, she would,
Glad to hear it. Yeah.
yeah, she would have thoughts about killing herself, and ultimately it boiled down to the theme of I'm no good, I'm not enough,
Mhm.
right? I'm somehow going to mess everything up that I try. And that was both her mom and her dad, right? And one of the things we worked on is just when you think that, you can almost chuckle a little bit and say, that's my dad's voice or that's my mom's voice, right? And obviously, they may never have told you, son, you should kill yourself. That's highly unlikely that that happened. But once you understand the root of the thought, and it doesn't frighten you so much on its face because you understand it, you can think the thought isn't really that I'm going to kill myself. The thought is this horrible thing I can think of doing. I'm so defective that I'm going to do it,
Mhm.
and it's someone else's voice. So I guess the ultimate lesson with psychoanalysis, even though people say it's about having insight and digging things up, it's really about accepting yourself and being okay with yourself just how you are, because you're good enough just the way you are,
Mhm.
right? And finding people who will be as kind and gentle towards you as you deserve for them to be.
Yeah.
Which, how much kindness and gentleness do you deserve? It's unlimited.
All of it. Yeah.
All of it.
Infinite.
Yeah,
Infinite. And then
exactly.
you get those corrective experiences, right? Those lived, interpersonal, connected moments
Yeah.
of kindness, gentleness, compassion, love.
Yep. And eventually you're an entirely different person.
Yeah,
Yeah.
eventually you are. Well, that's very hopeful.
Yeah. Oh, I've yet to meet anyone who I don't have any hope for. That's the thing. Because
Same.
I
Yeah.
think I think people can change drastically, and I think they deserve someone who has faith in them.
Yeah.
And they deserve someone who likes them. That
Mhm.
freaks some clients out when I talk to them and I tell them that I like them.
Maybe it's
So
because you're a dude with a beard. I don't know.
I think it is.
I have yet to freak out. I've had at this point, I've had, I think, definitely over 300 clients. And I've yet to freak someone out by telling them that I liked them, but maybe I'm just not doing it intensely enough.
I think it's because I remind people of their dad.
Yeah.
Which is weird because I'm younger than most of them, but that's the thing. I think I remind people of their father, and I think it's a little weird having like an emotionally open, available father who says, "I like you and I'm proud of you."
And what a powerful corrective
Corrective
relationship,
experience.
right?
Yeah,
You know?
exactly. Yeah,
hmm
yeah.
So this was great, Jordan.
I
Thank
thought it
you.
was. Yeah, I thought it went well.
Yeah. Yeah.
Yeah.
Is there, before I stop the recording, is there any other last thoughts you want to share?
Um, are there? No. I think I'm very bad at coming up with unprompted thoughts.
That's
And
not true.
is that really? I don't know. That's the I mean,
I feel like you have novel thoughts frequently. It can't be that they're all in, or maybe they're all in reaction to other things. I don't know.
well, that's no, I do have thoughts. I guess there's just I think there's a part of me that expects people to be not interested in unprompted thoughts. And you know why? Where that part of me comes from? That's my mother.
So, so Jordan.
That's not saying my mother is a bad person. It's just my mother was very easily stressed because she had a very stressful job. And so when I would say unprompted deep thoughts to her, she would feel activated by those, because usually when she would spend time with me, she was just trying to relax. And she felt like me having, thoughts that required her to engage were me interrupting her relaxation, which they were. But I took that as meaning that I projected that on everyone else and thought everyone else would be uninterested in my
Oh.
original thoughts.
Do
And
you think I'm uninterested or would feel
no,
interrupted?
No, I actually think that you're very interested in my, my thoughts. I like that a lot about you. So I guess if I had any thought to end a talk on psychoanalysis on, um, I guess the thought I would have is, do what works for you. Just
Mm,
that's the lesson. Folks tell you to be yourself, and often they don't really mean it, because as soon as you're not what they want or not what they need, they tend to beat you up or try to whip you into shape. But the thing about it is, you really it's really best to just be whatever you want to be.
mhm, mm,
So, and I
yeah,
think that's a healing experience. And that's what psychoanalysis is trying to teach us.
yeah. And I would add on to that, to sort of echo what you've been saying all along, I think is, um, you are already deserving of being in a relationship with other people who,
Mhm.
when you are your true self, they react to that with love and kindness
Yeah.
only.
Yep. And it
Right?
sounds unrealistic, and it's not.
It's not.
It's available.
All right, so that concludes first ever
Yeah.
Healing Heart Connections talk, and uh, stay tuned for more.
Yeah. I guess I'll probably see them again.